My feeling is that this Global NET survey will significantly improve the management of patients with neuroendocrine tumors. It will have an impact on how doctors are seeing this disease, and for me personally it was an eye-opener.
Well, what the survey shows us, and specifically the fact that a patient sees a bunch of healthcare specialists, it would mean that they would come from different disciplines, from different specialties. This obviously leads to the conclusion that in order to improve this and to shorten the journey to the proper diagnosis, we need to reach out to various specialties in medicine and try to raise awareness on this rare condition, try to educate or to motivate those professionals to educate themselves on another whole set of options so that they could apply it to the patients.
I think there are a number of key findings from the Global NET survey. One is the commonality of the experience of having a NET around the world. And other would be the length of time it takes to get a diagnosis. I think what we can do to help this is educate, educate, educate. The more patients know, the more physicians know, the more likely the earlier diagnosis will occur.
The amount of disease that was found late, or the delayed diagnosis, I think was obviously something that stood out to me, as well as I think some of the themes of frustration that some patients experience, both in trying to understand the disease and trying to get the appropriate care that they need.
It shows to us that most NET patients are being dealt with in the very early stages by general practitioners, non-NET specialists, healthcare providers. And it really was poignant that we need to educate these healthcare professionals about the NET disease and the NET presentation so that they are thinking of it.
I think many patients who I speak to have said, well, they seem like quite minimal symptoms, that I didn't want to go and sort of annoy or disturb a doctor with symptoms that I'm sure loads of other people have.
And it shows a large area of unmet need in education and increasing awareness of NET, be it an uncommon cancer in the general medical community and the community at large.
I think things are improving, and I think it's based on the education and awareness among physicians and also patients about these diseases. And also that the patient organizations, they can start to ask questions from other patients, which they know with a certain type of symptoms and maybe also the disease. So it's slowly improving.